Hey there, my name is Megan. I've been a nurse for almost 2 years, and in that 2-year course, I've worked at the neuro ICU here at a local trauma center. Um, and the first question we've been charged here is to share with the discussion group an example of one of the 3 principles that we've discussed this week. And the principle I'm going to discuss is pharmacodynamics. Working in the neuro ICU, we see a lot of patients come in with seizures, and if they've landed in the ICU, they are probably in status epilepticus. And one of the medications we give most of these patients is Dilantin or phenytoin. This is an anticonvulsant, and its pharmacodynamic properties, as we know, are illustrated by the mechanism of action, and we can see that because pharmacodynamic that we learned is it means the change in the body after the medication's been administered. The mechanism of action for this drug I actually found on rxlist.com, and that says that the primary site of action appears to be the motor cortex, which is where the spread of seizure activity is inhibited. So it works by promoting sodium efflux from neurons. Dilantin tends to stabilize the threshold against hyperexcitability caused by excessive stimulation or environmental changes capable of reducing the membrane sodium gradient. Dilantin reduces the maximum activity of brainstem center responsible for tonic phase of generalized tonic-clonic seizures. The second question is to explain how pharmacokinetics, dynamics, or pharmacogenetics principles relate to the patient that you care for. And this goes back to the seizure patients. It's important to understand the pharmacodynamics, because once you know that the excitability of the brain has been reduced, you can understand that you're going to see a little more lethargy, a little more just general sleepiness in your patients. And if you don't understand why that's happening or how that's happening, it's not going to make sense, why they're sleepy. And it could be concerning in a neuro ICU if you walk in and your patient's all of a sudden sleepy, because you're going to be thinking, oh, well, did they stroke? Did they bleed? And so understanding your pharmacodynamics is really important in that way. The third question is about pharmacogenetics, and it says, if you are interested in pharmacogenetics, but pharmacogenetics was not even considered at the time, explain how pharmacogenetics information about your patient would have provided a higher level of care and possibly better patient outcomes. So I did look up Dilantin and pharmacogenetics, and there's not much out there. So my understanding of pharmacogenetics is that it just analyzes each individual's kind of enzymes and how the patient would respond to the medication had we had a more individualized medication, basically specifically for that patient. And that was in the end of our chapter 5, I believe, and we also discussed it in our lecture notes and some lectures this module. And I think if we had a perfect drug that was if we were able to draw labs and kind of look at the enzymes that deal with maybe Dilantin and individualize it for this patient, we would of course have a better patient outcome. That's my brief understanding based off of 3 days of reading, and that's the end of my video. Thanks.